Hi, good evening. My name is Makarand Mody, and I'm an associate professor at the School of Hospitality Administration. And I'm here to present some research that actually demonstrates the fact that hospitality has a critical role to play in human flourishing in society today, particularly in the context of healthcare. So I, I'm sure that most, if not all of us in this room have actually been to a hospital or a healthcare facility. And hospitable is not perhaps a word that comes to mind, but my colleagues and I were really interested in examining whether hospitality informed design can play an important role in enhancing well-being for patients in hospitals. So we set about doing this looking at really two streams of literature. The first comes from environmental psychology and this concept of restorative design, which has shown that spaces can be designed to actually have a restorative effect on the users of a particular space. We also borrowed from the marketing literature and this concept of the servicescape, which has shown that marketers can actually design experiences that enhance well-being for the users of a particular space. So we were able to combine both theories as well as empirical approaches from both of these streams to actually look at our particular context. So as an example of some of the work that we've done, and we did multiple studies on this issue, the first study that we started off with was just to look at what features of a hotel-like design might patients actually value in a hospital room, and would that actually contribute to a higher sense of well-being? And we used a methodology here called conjoint analysis, which effectively involved patients in hospitals being presented with a variety of scenarios, and they had to make choices across these scenarios. Now, based on the choices that they actually made, and an example scenario is the one that you see on screen, based on the choices that they actually made, we were able to pinpoint exactly which design features from hospitality really added value to their experience in a hospital. Now, what was interesting is that we found that it was both the harder, the more tangible aspects of design, but also the softer or the more intangible aspects of design that led to a higher sense of well-being for hospital patients. So to give you one example, patients really valued healthcare staff that had been trained to hospitality standards. So healthcare staff that is not just providing them with really good clinical care, but also healthcare staff that treats them with empathy, with attentiveness, with responsiveness, qualities that you would actually find in a hospitality environment. We actually took our research further in other studies where we developed models to validate some of our initial findings. So again, using samples of hospital patients, we actually found that hospitality informed design, both the tangible as well as the intangible aspects, actually led to better outcomes. And the kind of outcomes that we measured were of importance both to patients as well as to the healthcare institutions themselves. So for example, there was a higher sense of well-being for hospital patients who valued these hospitality design features. And that's really important because higher well-being has been shown to lead to better medical outcomes as well, such as a reduced perception of pain or faster recovery from hospitals. And for the healthcare institutions, we actually found some important marketing outcomes, such as higher patient satisfaction scores that were reported on the HCAP survey. And this is a survey that's actually used for reimbursement for Medicare as well as Medicaid purposes. Now, while the research that we've done has been with hospital patients, we think that there's a huge scope to show how well-being can actually be enhanced through the introduction of hospitality for caregivers, for families, as well as for healthcare workers themselves. And it's really no surprise that the root of the word, the words hospitality and hospital actually have the same root, and they lie in the concept of caring for the stranger. Thank you very much.